Good morning, Doc. Today, we will discuss stimulant use disorder. Let's begin with the definition. How would you describe this condition?
Good morning, Drive, Tony. Stimulant use disorder refers to a range of problems associated with the misuse of stimulant drugs. These drugs speed up brain activity, increasing alertness, attention, and energy levels. However, their prolonged excessive use can lead to serious physical and psychological dependence.
That is correct. Can you list some of the most commonly abused stimulants?
The most commonly abused stimulants include cocaine, methamphetamine, dextroamphetamine, methylphenidate, commonly known as Ritalin, ephedrine, nicotine.
Good. Now, let us discuss the signs and symptoms of stimulant use. What are the common effects seen in individuals who misuse stimulants?
The common signs and symptoms of stimulant use include anxiety, confusion, paranoia, decreased sexual function, poor judgment, increased appetite, and weight loss.
That is correct. Prolonged use of stimulants can lead to severe long-term effects. Can you outline some of these complications?
Yes, long-term effects of stimulant use include aggression, hallucinations, tooth decay, skin sores, significant weight loss, social isolation, dramatic behavioral changes, gastrointestinal problems, respiratory, cardiovascular, and nervous system damage, kidney failure, cognitive deficits and poor judgment, loss of short-term memory, and muscular weakness.
Excellent, Doc. Stimulant withdrawal, also known as stimulant abstinence syndrome, presents with a distinct set of symptoms. Can you describe the common physiological symptoms of withdrawal?
Yes, the physiological symptoms of stimulant withdrawal include weight gain, dehydration, fatigue and lassitude, with lack of mental or physical energy, dull sensorium, psychomotor lethargy and retardation, which may be preceded by agitation, increased hunger, chills, insomnia, followed by hypersomnia.
Very good. What about the psychological and behavioral symptoms of stimulant withdrawal?
The psychological and behavioral symptoms of stimulant withdrawal include a dysphoric mood that may deepen into clinical depression and suicidal thoughts, persistent and intense drug cravings, anxiety and irritability, impaired memory, anhedonia, which refers to the loss of interest in previously pleasurable activities, interpersonal withdrawal, intense and vivid drug-related dreams.
Well done. Moving forward, let us talk about the investigations that are important in diagnosing stimulant use disorder. What laboratory tests would you request?
Investigations for stimulant use disorder include drugs of abuse panel DOA6 to detect stimulant drugs in the urine, brief screener for alcohol, tobacco, and other drugs BSTAD to assess substance use, full blood count FBC to evaluate for infections or anemia, hepatitis B and human immunodeficiency virus HIV testing to screen for blood-borne infections, rapid plasma reagent RPR test to screen for syphilis, liver function tests LFTs to assess liver health, kidney function tests KFTs to evaluate renal health, urea, electrolytes, and creatinine to assess dehydration and electrolyte imbalances.
Good job, Doc. Now, let us discuss treatment options. Are there any approved medications for stimulant use disorder?
No, currently there are no approved medications for stimulant use disorder. This means that behavioral therapy and psychological support are the main forms of treatment.
That is correct. Since there is no specific pharmacological treatment, we rely on non-pharmacological approaches. Can you list these interventions?
The non-pharmacological treatment options for stimulant use disorder include 1. Contingency management, a behavioral therapy approach that uses positive reinforcement, such as rewards, to encourage abstinence from stimulants. 2. Cognitive behavioral therapy, a form of psychotherapy that helps patients recognize and change negative thought patterns and behaviors related to stimulant use. 3. Relapse prevention strategies, techniques that help patients identify triggers and develop coping mechanisms to prevent relapse. 4. Motivational interviewing or motivation enhancement therapy, a counseling approach that strengthens a person's motivation to change substance use behaviors.
Excellent, Doc. You have covered stimulant use disorder comprehensively. This is a very challenging condition to manage, but with proper psychological support, patients can achieve long-term recovery. Next time, we will discuss another substance use disorder. Keep up the great work.